Can diabetes make me blind? An awareness program organized by DrINeed.com and conducted by Dr. Shahnawaz Kazi. Welcome to DrINeed.com. Dr. iNeed is a virtual digital healthcare platform. It provides you with online consultations with access to experts and specialists doctors. Find the best doctor or specialist to look over your reports. Get primary ideas, advice, or best suggestions about your illness at your convenience. You can have a second opinion easily with experts before you go for surgery or any treatment. Awareness programs, online meets are live meetings with expert doctors and consultants on various healthcare topics. The consultation fee is very reasonable. Visit DrINeed.com and register in simple steps. Watch Awareness Program conducted on the topic. Can diabetes make me blind? By Dr. Shahnawaz Kazi.
Okay, so I welcome you all in the first webinar, which is being organized by Dr. iNeed. So with this platform, hopefully we'll be able to cater to a lot of people who are in need. And Irfan Bhai is doing a good job in getting the website organized and getting things in the right place for this particular site. Okay, so this is the first webinar of what we would be going ahead. And the topic that I've chosen today is diabetic retinopathy and how it affects the eyes and why it is important for us. Okay, so can you see my screen now? Okay, so I'm Dr. Shahnawaz and I'm an eye specialist and a retina specialist. And that is the reason this topic is very dear to me. Diabetes is a disease that affects a lot of people. And nowadays, with the lifestyle that we are following nowadays, diabetes is becoming much more prevalent than before. Also, the pandemic has added its own woes. And because of the pandemic, people have to stay in house. And because of being staying in house, their sugars again have started going haywire. A lot of people are not able to get their tests in time. And because of that reason also, their diabetic process gets worse. And if the diabetic process gets worse, then the eyes and the kidneys and all organs can get affected. So the question that we have in front of us is, can diabetes make me blind? So we're going to try and understand on how things happen and why do people become blind because of diabetes. Of course, the most important thing is an uncontrolled diabetes. And if you see the worldwide global estimates of diabetes, and it is actually a worldwide problem, not just in our country, and all the developed countries also have this problem. So in our country, in the past, we were struggling with infections and other things, but now diabetes has taken over and our kind of population is huge. Also, our dietary habits of eating more carbohydrates has also led to us becoming sort of a leaders in the diabetic process in the world. Okay, loss of vision is the most feared complication of diabetes. So the most worst thing that the patient fears that he's going to get blind because of diabetes. Of course, diabetes affects a lot of organs. We'll see what they are and how it happens. So feeling about complications at diagnosis is 63% knew that these health problems might affect them in future, but the risk seemed remote. So a lot of people feel that, okay, this is there, I have diabetes, but maybe I'm not going to get affected with this. And there are 63% people in this particular category. 25% of the people feel that they are devastated and they are always afraid that they are going to develop some kind of problem because of diabetes, right? 9% were not really concerned, they are not bothered, hoga to dekhenge types, and 3% have fall into none of these categories. So this is the feeling how a patient of diabetes feels, or if you take 100 people, how each category would fit into each. Now, the complication that patients were most concerned about is eyes, and 50% were worried about their eyes. And others were worried about the heart. 21% are worried about heart because, of course, if you have life, then you have everything. And if your heart is not working, then you are no more. So heart is the second most thing that the people are fearing. Of course, first is the eyes, followed by kidneys, because kidneys, once the patient's kidneys get affected because of diabetes, then they either require to undergo dialysis regularly or undergo a transplant for the kidneys to get rid of the problems. Other issues are circulatory issues, problems of the feet and legs. A lot of people get bad feet and they have to sort of cut their feet off, and because of that they have a lot of difficulties in their lifestyle, and 7% are other things which, because of diabetes, infections get more common, and you have to take a lot of antibiotics on and off. So this is the from this slide we understand that the most feared thing in a diabetic is loss of vision, and that the patient can become blind because of it. This is a slide which showing the principal fears as we discussed in the previous slide. A lot of people are not worried, but what they are worried about is blindness, one, kidney, heart, and self-treated hypoglycemia. Because hypoglycemia is again another dreaded thing, because certain patients suddenly go into a low sugar, and because of that they could get unconscious and things like that, and they are worried about that as well. Now, the other things that can affect a patient of diabetes is stroke, which can happen in the brain, diabetic retinopathy, of course, which happens in the eyes, heart disease, and nephropathy, the kidneys get affected, and the cholesterol goes very high. And the reason why the feet get affected is the neuropathy, because the nerves of the feet get affected. Now, just going through a little bit of anatomy so that everybody understands how the eye works and why actually what leads to the blindness. So if you see here, I will just highlight that. Okay. Right. So this is the eye that we see from outside, and this is the cut section of the eye, where this is the cornea in the front part. We have the lens out here, and this innermost layer is the retina. Okay, and this is what the innermost layer which is getting affected in diabetes. So as you see, the center of the retina here is the fovea, and this is where the most important vision center lies. What we read, what we see, the faces that we recognize, all are falling here. So if there's any issue which happens in this foveal level, then the patients could start feeling that they're not able to manage their daily activities. And this is the blood vessels that go into the eyes and supplies the whole retina. So sometimes there could be circulatory issues where the blood is not reaching the eye completely. Okay, right. So this is just a brief anatomy. Then we go ahead on what really happens within the eyes. So what is retinopathy? Retinopathy is caused by damage to blood vessels at the back of the eye, that is the retina. And you see, this is the left side is showing a normal retina, which is with a normal disc. Okay, I'll just take that again. Okay, so we have, this is the normal nerve of the eyes, and this is the center of the macula that I showed you. And if there's any problem here, then you could have a vision drop. As you can see in this particular photo on the right side, there are all these new blood vessels that have developed on the optic nerve disc, and we can see these white spots, which indicates that blood is not reaching these areas properly, and they are partly infarcted. There could be new blood vessel formation, which we call as neovascularization, and there could be small microaneurysms. We'll see what that is in some time. And these white spots are called as cotton wool spots. And this is how when we see the retina, we see such things happening inside the eyes. Okay. This is another photograph which is showing that there is bleeding on the surface of the retina, and such kind of bleedings are seen very commonly in diabetic patients. So this is the micro vasculature of the eyes, where the blood vessels are seen. This is a normal eye on the left side, and on the right side we are seeing eye with microaneurysm, wherein there is an outpouching of this vessel. You can see here this thing. There is a bunch which is formed out of the blood vessels. Now, when this bunch forms, see, these blood vessels are all normal here, right? They don't have any outpouching. When there is an outpouching from here, then those cells are not normal, and because of this outpouching, there is leakage of the blood out of these blood vessels. And because of this leakage, all the problems that we see in the retina happen. So the factors that lead to the diabetic retinopathy, what are the things? If your sugars are not controlled well, if you are a diabetic for a very long time, the duration, and if your control is very bad. So if your control is good, then it could delay your process. Along with diabetes, if there is hypertension, then that adds to the problems. if there is a kidney disease, that can also cause a problem. Patients who get pregnant and are diabetic at the same time, the chances of retina getting affected is much more. Of course, smoking and anemia also add to the problems. So this is the layer that we saw, the retina, and if we cut and see a microscopic section of the eye, it is looking like this. And these are the blood vessels which are below the retina. And yeah. So the most common reason why there is a drop in vision is macular edema. The macula is the center of the eye, as I told you already. So macular edema is defined as thickening of the retina, and this thickening happens because there is leakage from these blood vessels. Now, these changes compromise the blood retinal barrier, and because of that, the plasma that is present in the blood leaks out of these blood vessels. And because of that, we get diabetic macular edema, which in short is called DME. So this is a photograph kind of a thing showing what are the problems that happen. And you can see here that there is leakage that is happening. And because of the leakage, the blood is leaving back these yellow spots, which are actually lipids that stay behind. And because of the constant leakage, there is damage to the photoreceptors, which are the rods and cones within the eye. And you can see these whitish things here. These are the swelling which can develop in the eye. So what are the symptoms? In the early stages, patient may not feel anything, but as it progresses, there could be blurred central vision, which means that the patients are not able to read, write well, or they may not be able to recognize faces well. There could be difficulty in reading. There could be floaters like black spots coming in front of the eyes, and objects could appear distorted. So these are the symptoms that a patient of a diabetes should be looking out for. And if not, at least an yearly eye checkup, even if there's no problem, will diagnose a problem faster, and then we are able to at least keep things under control. A lot of patients, they don't check their eyes at all, and then when they come to us at a very late stage, it becomes very difficult for us to save these eyes. So we saw this slide before, the risk factors, duration of the diabetes, and the level of HbA1c. HbA1c is done at 3 months to see how the overall control has been over the past 3 months. So this is a test which a lot of people should be doing who are diabetics, and if this is high, the risk of eyes getting affected is high. Of course, as I already shared, if there is high blood pressure, again, that can be a risk factor. And cholesterol, if the cholesterol is high, that also leads to the deposition of fats in the eyes. Genetic factors, if somebody is genetically more predisposed to a retinopathy, they could have, and pregnant women I've already discussed before. So what do we do and how do we come to know about this? First thing that we do is basic vision test to find out if the vision is normal or no. And if the vision is lesser, then we would want to do further tests. So for whether a further test, we put drops in the eyes, we dilate the pupils, and then once the pupil is dilated, we actually directly observe the retina and the optic nerve, the photographs of which I already showed you. There's another test which is called as the OCT, which is optical coherence tomography. This technique is similar to an ultrasound, but it uses light instead of sound to capture the images of the retina. Now, to see how the blood flow is there within the retina, we do a fluorescein angiography to see if there are any leaky blood vessels or if there is some area where the blood is not reaching at all. And if there is anything like that, then we would need to treat that. Okay. So any questions can come in the chat so we can sort of try to answer that. Factors to consider for treatment. Of course, the first thing is a good sugar control, blood pressure control, and cholesterol control, which of course a physician will be helping you out with. But even then, if you have swelling within the eyes, then there are certain injections that are given into the eyes. Or the second option is to do a laser, or the third option is some steroid injections which can be given within the eyes. How do you prevent it? Take your medicines as prescribed by a doctor, reach and maintain a healthy weight, add physical activity to your daily routine, control your ABCs. So ABC is HbA1c, which is the A, B is the BP, and C is the cholesterol. So these three things, your ABC, if you control, then the risk of your retina getting affected is quite less. And if anybody is a smoker, then just keep the habit of smoking. So that is what they've done here. Track. T is take your medicines. R is reach and maintain your healthy weight. A is add physical activity. C is control ABC. And K is kicking the smoking habit. So this is the short form of what we have done. There was a trial which showed that if the weight is controlled and if all the parameters are controlled, then the effect on the eyes is also much lesser. So this we conclude that loss of vision is the most feared complication. DME, that is diabetic macular edema, is the most common cause of vision impairment, and DME affects working age and therefore requires a longer term of management. Patients with diabetes are at an increased risk of several comorbid and chronic conditions, which is increased further in patients with DME. So this is a small slide. I have not kept a lot of things so that we don't want to complicate it. There could be other complications also that could happen, and if anybody is interested, I can share more of the slides. At this moment, if anybody has questions, I'll be happy to take them.
Sir, is there any symptoms before we come to know that we got a diabetes retina, something like that in our vision?
Right. So I shared the slide wherein we said that first of all there could be no symptoms at all. Secondly,
Okay.
there could be blurriness in the central vision, and thirdly, there could be distortion in the vision, and fourthly, there could be floaters that the patients get. So these are the symptoms that some patients can get. All of them may not get it, and a lot of patients who don't check their eyes regularly, they could develop an advanced stage of retinopathy. So we would want to check the patients before the problems become too much.
Perfect. Thank you, sir.
Yeah. Any other questions?
Doctor, is there any specific age for this, like you get in your teens or your adulthood?
Yeah, so it is depending upon the diabetes when anybody gets diabetes. So if somebody is getting diabetes at a younger age, they are at a higher risk and they should be checking their eyes at that young age itself. Nowadays, we are seeing a lot of younger people with diabetes. Earlier, it used to be only after 50 that people used to get. But nowadays, as I said, with the lifestyle and things like that, a lot of younger people are getting diabetes. And if anybody has got diabetes at a younger age, then they are at a much higher risk for the simple reason that their duration of diabetes is going to be much longer than a person who's getting it at 50. So if anybody is getting diabetes at say 30, then he's going to technically live at least 20 or 30 years more than a person who's getting it at 50. So their risk is much higher, and that's why their control also should be very good, and their regular eye checkup screening yearly is very important.
Oh, thank you, doctor.
Is there any option we can understand online if we have diabetics or not, or what problems we are going? Just talking to you.
Just
Online
by talking,
to you.
if they are symptomatic, as I said, if the symptoms are clear, sometimes they would come out with the symptoms, but a lot of times the periphery gets affected and the patient may not have any symptoms. That is the reason we say that whenever you're diagnosed with diabetes, the first thing is that you check your eyes first. And if not, then after that, every yearly we have to see the eyes. That is the recommendation that we give patients. So by talking, we may not be able to diagnose diabetic retinopathy.
In case we discuss with you and I say there are certain things going with us, some certain symptoms we see that we are feeling that we are diabetics. So can talking to you or can you guide us to local doctors or somewhere?
Yeah, unfortunately, any local doctor will not be able to pick up diabetic retinopathy. So the eyes have to be tested, and as I told you, we have to dilate the pupils and then check the eyes. So if there is dilatation and the eyes are checked, only that is a way to pick up. There could be some scans which can be done, but scans will just give a particular picture of a thing, and it doesn't give us the overall picture. So the best thing is to get the eyes or retina tested after dilatation by a retina specialist.
One more question: how this online consultation can help us in case we have some problem in eyes or maybe other part of the body. So how this online consultation will help us?
With online consultation, we can understand the symptoms and then maybe guide for certain tests. Now, with the pandemic, earlier we were saying absolute no to online consultations because a lot of things cannot be diagnosed online. And we may not be able to even check the vision properly in an online consultation. And that is the basis for our testing. So we can just try and understand the symptoms, and then with that, maybe try to guide them for further tests. Nowadays, with that OCT scan available, we are able to do some tests at home also. So certain patients who are bedridden or who cannot come out, or again for the fear of corona, we can help them with some scans which can be done at home itself.
Now, any guidelines for us to save our eye vision?
Guidelines nowadays, the computer uses too much. So first of all, you have to be careful when you're using the computers. Take breaks often and drink a lot of water. Blink eyes often. These are general guidelines for screen time use. Again, the exercise that I shared with you in one of the slides is that our physical activities are getting lesser. So with that, people who did not have diabetes before are getting diabetes. So we have to see that we keep ourselves healthy. So regular exercise and a routine in that should help, even for a diabetic and a non-diabetic. So if person is non-diabetic, he can get obese, and if he gets obese, then again all these issues can come up.
Thank you so much, sir, for being with us. It was really nice presentation, and everybody was looking for, and it was really informative. And I hope that we get more people to join next week. If
Definitely.
you provide, if you give us any confirmation date in the future, we'll talk about this later on. And really thankful, and thank you from a whole of our team, like Dr. I Need team, and from Unified also. And
Yeah.
thanks for joining us, sir. It was
Thank you.
great
Thank you. Thank you.
having live meeting with you, sir.
Thank you. Thank you. So my pleasure
Thank you,
being
sir.
with you and sharing a little bit of thing that I had. And we look forward to more further meetings like this, where we can have more interaction, and we reach out to the people so that people are benefit at large and share.
Definitely, sir. Thank you so much. Thanks for your precious time, sir.
My pleasure.
Have a good day, sir.
Thank you.
Thank you, sir.